Hi, good afternoon, everyone. Thank you for joining us today on this panel on Africa's pharmaceutical sector and COVID-19, the supply chain dimension. So I think this panel is quite timely. We've seen that there are reports of shutdowns of pharmaceutical manufacturing facilities in India and China. There are reports of increased prices of raw materials for pharmaceutical products, as well as export restrictions being placed by many countries. And all of these have really exposed Africa's vulnerabilities in this sector and interdependencies in this sector. And as a result of this, there's a renewed focus on boosting intra-regional trade in pharmaceutical sector within the continent. And I think we're joined today by an excellent range of experts across the panel to speak to this end and to discuss some of the supply side shocks that we're seeing in the pharmaceutical sector during the pandemic, what planning actually looks like as the crisis progresses, and also the need for a supplier management system which is more robust and resilient to economic shocks. So let me just start off by introducing myself, and then I'll do a quick round of introductions to the panelists, and then we can jump right in. So I'm Karishma Banga. I work as a research fellow at the Overseas Development Institute, and I broadly research areas of international trade, global value chains, regional and global integration with expertise in East Africa and India. And recently, we've also done some work with UNECA, so the United Nations Economic Commission for Africa, on trade and COVID, looking at the supply side dimension with pharmaceuticals as a key sector for the continent. And I think we're joined today with members from UNECA as well as from Pfizer Laboratories and the Center for Humanitarian Pharmaceutical Activities. And so, as I mentioned, we have some really rich pool of experts to start this discussion. So first, we're going to have Joseph. So Joseph is from UNECA. He's an epidemiologist, pharmacologist with years of combined experience in pharmaceuticals and public health. And he has held various positions in governmental and intergovernmental organizations, and recently has also worked on pharmaceutical at the Southern African Development Community Secretariat. And he has rich expertise in pooled procurement, local production, quality standards, and R&D in pharmaceuticals. Then we're joined by Dr. Alassane, who has a combined strong experience of GMP guideline, national pharmaceutical policy, pharmaceutical regulations, audits of pharmaceutical units, quality systems, and management at central and field level with international pharmaceutical companies. And then we have Mrs. Bridget, who is the supply chain director at Pfizer Laboratories and has been working. She has 23 years of experience in private sector supply chain, mainly focused on demand planning, sales, and operation planning, and is currently based in South Africa. So maybe as a starting point, I'll maybe look towards Joseph and just really get the conversation going around this. Perhaps Joseph, you can just tell us a little bit about what really is the role of pharmaceuticals products in public health emergencies, such as COVID that we are seeing today. So what really is the role of this industry during such crises?
Thank you so much for the introduction and indeed for inviting us to participate in this very important event. As you know, public health generally, especially in terms of emergencies, entails that there is a problem in communities and also there are effects of the disease that go beyond just suffering, but also there is an increased morbidity and mortality. So when it comes to pharmaceuticals, particularly in line with what has happened with COVID, apart from a lack of products that has been what would be directed to COVID itself, COVID-19, the public health emergencies tend to disrupt the supply chain of other products. For instance, right now, as we have experienced in Africa, we have noted that most countries have diverted their budgets in procuring products that are mitigating COVID. and not necessarily neglecting, but that has affected the supply chain of other products. For instance, hypertension, diabetes, chronic respiratory diseases, reproductive problems, reproductive health for mothers, vaccinations for children. So you find that there is a disruption in the normal supply of these products. So the pharmaceutical industry still has to maintain itself in ensuring that all sectors are provided for. But what is happening with public health emergencies is that the other areas are affected. So someone may be affected with COVID, the PPEs and other products will be there, but can still be affected by hypertension because there's a disruption in the supply. We have shortages right now and stock out of essential medicines, whether it's malaria, for TB, for HIV, because the concentration has gone to COVID. That's one. Secondly, the other part is that the pharmaceutical industry is critical in public health emergencies because they're the ones to come up with the new products in terms of manufacturing and also the scientific arena in terms of research and development. So that we still need the pharmaceutical industry to supply and continue with the supply chain to ensure that all the products that are necessary and needed to respond to the emergency at hand are catered for. So in a nutshell, we can say that there's need for continuous supply, continuous research, and also clinical trials that are necessary in terms of ensuring that we have in place new products that can respond to the emergency at hand. I'll just start by that, then I'll go into detail a little later. Thank you.
Yeah, thanks, Joseph. I think that's very useful to, acknowledge that it's not just the first order effects, but also the second order effects, of the pandemic, that you don't just need medicines for the COVID crisis, but it's also about ensuring and maintaining the resilience of supply chains for other diseases as well. And maybe you can touch a little bit about now on what are some of the specific shocks, supply side shocks, that are occurring in the supply chain for medicines and pharmaceutical products during the pandemic.
What is happening now is that globally and continentally in Africa, the lockdown that we suffered, which was unexpected, unprecedented lockdown effect, they negatively affected the availability of because almost all borders were closed and people were not moving. Pharmacies were also accounted in terms of given time for opening. So generally, I was saying that this COVID has negatively affected the supply chain and that the lockdown effect in almost all countries led to closure of borders, closure of airports, restricted movements of people, curfews were imposed, and there was general disruption of care in that even the prescribers did not even have adequate time to explain to patients when they were giving medicine, because they would give long-term supplies, which also meant that some of the products would expire while they are with the patient. So generally, the access to medicines availability was a problem. Secondly, the cost of these products suddenly went up. The medicines were being unaffordable because most patients use out-of-pocket supply, and in Africa, we don't even have available insurance systems that would cater for the majority who are impoverished. As we know that most of the African people live below the $2 poverty line, where they need, they don't have resources, no finances to manage their own health. So the lockdown effect was the first one that impeded the public health system and did not even help in most cases, because whatever products were available, there was no control in terms of pricing. The other thing is that, as I indicated earlier, the pandemic itself became a threat because almost all the essential medicines stocked out. In other words, there was no replenishment, no reordering. And whilst the people are protecting themselves against COVID, other diseases, let's say measles was affecting children, adults are being affected by diabetes and hypertension. The stress that was associated with the COVID also brought up a lot of mental health problems. Gender-based violence is one of the issues that came up again, which also indirectly is dealing with issues of pharmaceuticals, because women had no access to family planning products, and hence they could not prevent pregnancies. And you can imagine in situations where in Africa here, a man tends to be, in terms of conjugal rights, a woman cannot say no because she knows that she may become pregnant, and that raised a lot of issues of gender-based violence. And again, when it came to confirmed cases of COVID, you would find that if a woman would get positive and a man would refuse to get tested, then this woman would not even be supported emotionally. And again, they got generally affected. So pharmaceuticals as products do not stand alone in the supply chain or in the health systems. But generally, there was lack of access to medicines, unaffordability. And one other thing which I did not mention is that the issue of substandard and products, counterfeited products, also reappeared on the market, so that the issue of quality was not a matter, because our system, generally the regulatory system is very poor in most countries. So people were subjected to getting products that are not even well regulated, which includes African traditional medicine, which caused even more problems than the pharmaceutical product. Again, the manufacturing, most of our countries rely on imports from India and Europe, and we import over 90% of the products. So stockouts have been the order until this time.
Great. Thank you, Joseph. So I think you touched upon some very, very key issues there in terms of some of the supply side shocks that we have been seeing in terms of both availability of materials, but also access to these materials and rising cost of intermediate pharmaceutical inputs. And I think you also touched upon critical issues that go just beyond access, including on gender, as well as substandard products, proliferation of these products within the continent, as I mentioned, as second order effects of the pandemic. So I think that's very useful. And an interesting statistic that you just mentioned was that over 90% of the products, intermediate products in pharmaceuticals in Africa are actually imported from abroad. So I think that just goes to highlight some of the interdependencies that Africa really has on other economies, particularly in this sector. So thank you. I think that was very useful. And maybe I can now just call upon Bridget to maybe discuss this a little bit further. So how has the African pharma supply chain responded to the ongoing COVID-19 pandemic? In your opinion, do you see any new opportunities for improvements, or the way these value chains or these supply chains are operating, or do you also see a range of these supply side shocks and disturbances to the sector? Thanks, Bridget. Over to you.
Yeah, so thanks, Karishma, for asking that question. And Joseph, yes, I agree with the different impacts that the pandemic has had, especially on the medicine supply. From a supply chain perspective, there were many areas that we needed to focus on during the pandemic. So, for example, the volatility in demand, for example, we didn't just see demand increase for certain products, but there was also a large decline in some of the products as well, where we then started seeing, very high stock levels. So, for instance, products for elective surgeries, where people weren't electing to have surgeries at that time. For those medicines, our demand decreased quite drastically. Coupled with that, we had a high level of airline capacity reduction due to flights being grounded, where we had to switch sometimes in mode of transport, and then we had longer lead times to get products into markets. We had border closures, our capacity planning at the manufacturing sites. We had to relook at our capacity planning and switch our planning from different products. So we reduced our manufacturing on some products and increased it on other sides to ensure that we met the demand of the patients. So it was really difficult to predict the actual patient's needs during this time, and we had to look at some modeling to be able to determine what products were needed and when. And it also required a lot of close collaboration, both internally within our own organizations, but also externally with our customers as well, to try and determine what would the real need for our patients be. So yeah, I think that for the future, we've learned a lot from this pandemic from a supply chain perspective. I agree with Joseph, about 90% of our products or medicines that we use in Africa are imported, and perhaps it would be good to look at trying to support ourselves locally and increase our manufacturing capabilities in markets or in country within Africa as well.
Right. Thanks, Bridget. So I think, common challenges are emerging between sort of your intervention and Joseph's intervention around longer lead times, travel closure, bans, suspension of manufacturing operations, not just within Africa, but also, in other countries that African countries are importing from. And all of this are creating important supply side shocks and obstacles to access to these medicines. And I was wondering, Bridget, maybe you could elaborate a little bit on a point that you mentioned, which I thought was very interesting, is around also the demand side shocks and disruptions that we're seeing. So, we have customers stockpiling medicines, also mentioned by Joseph, that not just for COVID, but generally you have customers, getting in this rage and stockpiling medicines. And so how do you really avoid or deal with these supply side shocks, but at the same time maintain the agility in supply side, in the supply chain? So maybe you want to come in quickly on that.
Sure. So if I can speak about stockpiling, so we saw both sides of, stock levels. On the one side, we were, we didn't have enough stock, and on other sides, we saw we had too much stock. And we were really guided by customer interactions on what the actual need would be in market. But besides that, we also used external reports or that were publicly available, such as the CDC reports, to try and determine number of cases, what the healthcare industry was looking at, what types of medicines they were looking at to treat the side effects of COVID. And through that, we did some internal modeling. We used some external partners as well, some consultants to help us to determine, especially determining the second wave. So the first wave obviously hit us from nowhere. So we were very reactive. But right now we have been working with demand planning modeling, and data is really driving our decisions on what the second wave would look like. To determine what the demand would be and for which products. So we most certainly do have some products we can already see that are overstocked, and where not only just in the public sector, but also in the private sector, where we were asked to specifically bring in a quantity of products, which we did do, and now that stock is not moving. So the idea around overstocking is really to have in-depth discussions with your customers and really understand what the true need is in markets, and also monitoring your in-market sales and see how that, and stock levels, to see if, what is being demanded is a real true reflection of what is needed. And you have to sometimes make a decision and take a risk on whether you manufacture the quantities that have been asked for or not, because you know that you could be overstocking the market, and you could land up with obsolescence that you need to write off. So sometimes you need to make those hard decisions from a risk perspective. With regards to your question on agility, definitely an agile supply chain doesn't happen overnight. It's something that you would have had to be working on as an organization over a couple of years to get to. You most certainly can't do it once a pandemic hits. You have to really be in that situation where you can quickly adapt. And not every product or every supplier needs to be agile. So you would need to definitely segment your products and your suppliers to determine, which of those need to be agile, and make that decision beforehand. And lastly, on the agile part is, it's not just your own manufacturing, but you've got to look further up the supply chain, and it's your suppliers of raw materials, and excipients, etc., that you also need to review and make sure that they are on board to be able to meet your agile need to supply the medicines.
Great. Thank you, Bridget. That was very useful. So we spoke a little bit about the importance of monitoring and calculated risks in managing some of the demand side challenges posed as a result of the pandemic, and also the importance of sort of longer term planning and going upstream in the supply chain to really sort of maintain that agility for certain products. So I think that also very nicely deals with both supply and demand side challenges. And we've spoken now a bit about these challenges that COVID poses to better manage problems caused by by the interdependencies. And I was wondering, I think it would be a good time now to start discussing some of the the operational procedures for these supply chains. So maybe Joseph, we can hear from you a little bit about, is there really a need for Africa now to boost pharmaceutical manufacturing, within the continent, so local pharmaceutical manufacturing, and what really is the role of joint and pooled procurement of these products? And I know that you've been working on the pharmaceutical protocol in, the AFCFTA. So maybe you can just touch a little bit about that, and really, just kind of bring that into the role for domestic pharmaceutical manufacturing.
Thank you. For some time now, the issue of local production has been addressed. And we know that currently there's only 28% of the pharmaceuticals from local manufacturers which are produced, and less than 10% of these are actually on the market. And so far, only South Africa, Egypt, Kenya, and Morocco are producing actively for the African market. But also, as indicated, is that the issue of the active pharmaceutical ingredients is another area where African manufacturers are quite active. Again, it's mainly South Africa and Egypt. But what has happened is that besides the input from Kenya or Ethiopia, the African continent in 2007 under the African Union, they approved a roadmap for promoting pharmaceutical manufacturing under what is called the Pharmaceutical Manufacturing Plan for Africa. And this was a deliberate move to capacitate African manufacturers, as noted, so that the fronts of manufacturing efforts by those countries that I've listed are intensified, and also so that we address the common pitfalls that affect the industry. We realize that it's not only about the countries producing, but the technology itself needed to be capacitated, because most countries have tried to put up infrastructure, but there's been an issue of human resource. There are no pharmaceutical engineers and chemists, a lack of pharmacists. And as such, when it comes to issues of having associations that are promoting local production, despite being there, the infrastructure has been a problem. The other thing is that under NEPAD, again, there's been an effort of promoting what is called the African Medicines Regulatory Harmonization Program. The critical problem about manufacturing is about standards and quality as well, where we need to have very good quality control system, quality control laboratories, so that the active ingredients that in products are those that are internationally recognized, and also looking at issues of safety. There are several federations that have been formed in Africa. There is an African Pharmaceutical Manufacturers Association. We have an association there are two associations in South Africa, one for generics and the other one for branded products. But still more, with emerging and re-emerging diseases, the efforts by the ECA, for instance, under the AFCFTA, liberalizing trade, there is a promotion of ensuring that local produced products by African manufacturers should benefit, first of all, the African market. So that even if they don't attract a lot of resources, but generally there is appreciation of ensuring that what is being produced in Africa is also consumed within Africa. The only problem that we have had is under regulatory issues. There are issues of African Medicines Agency under the African Union. It has taken a long time to ratify this under the Act, but it's a matter that is still being pursued. So in response to these catastrophic effects of COVID, UNECA itself, together with African Union Commission, they have put up a platform which came through the initiative from His Excellency the President of South Africa, the current president, who is also the AUC chair. They have put up what is called an African Medical Supplies Platform, which is generally trying to improve the supply chain of availability and access of products. Although generally was put for COVID, now this is responding together with the efforts of ECA to address other products and also other devices as well, not only medicines. So in general, yes, there's been effort of ensuring that Africa uplifts the standard to produce the medicines. However, there are concerns that needs to be addressed in the backfill. Issues of environment and the issues of dealing with quality of water has been a problem. We have countries that have put up the huge infrastructure for producing medicines, but they're non-functional because they can't meet quality standards that are prescribed by the stringent regulatory authorities. So yes, efforts in Africa are being made under the African Union, under regional economic communities, whether East Africa, West Africa, Southern Africa. There are efforts of ensuring that under various associations, those manufacturers that need capacitation can actually get that support. We have an initiative currently that is ongoing, supporting the 10 countries, including the Indian Islands states, by ECA, which is only a pilot arrangement, looking at local production and food procurement. But this is concentrating or looking at only reproductive health products, as well as mother and child health, as well as adolescent products. So we'll see from these whether we can have an issue in terms of manufacturing. But so far, the expression of interest that was put up to look at the existing local manufacturers who can produce those listed products for mother, infants, as well as neonatal child health products. There are no African manufacturers that have shown up. There are very few who have responded to say they can produce even family planning contraceptive pills. We have this issue of relying on external producers. So some of the manufacturers in Africa, you find that they are actually agents in Africa. They don't actually manufacture, but some of them just play a role in the supply chain of repackaging. So in short, the AU has put up a plan, but these are plans. They are not really being implemented at the moment, so that those manufacturers that are trying hard, they need support, particularly financial support, to build their capacity, to intensify their production so that it can meet the deficit that Africa is facing. So most of them are really, and now with all these COVID effects, some of them are almost closing down because they cannot get refinancing of their production ability. Thank you.
Great. Thank you, Joseph. I think you touched upon, a range of very important issues that are also interrelated to each other and compounding some of the challenges that we are seeing in boosting domestic capabilities of the pharmaceutical sector on the continent. So I note that you mentioned that 28% of the production, only 28% is basically locally sourced. And you also have a wide gap in terms of some superstar countries in this sector, such as South Africa, Egypt, Kenya, and Morocco, sort of taking the lead with other African countries lagging behind when we talk about this sector. And I think particularly interesting is, that you mentioned the African Pharmaceutical Manufacturing Plan, which is, so to say, the roadmap that the African Continental Free Trade Agreement can build on to really leverage intra-regional trade in the sector. And again, I think with the AFCFTA, it's touching upon a range of issues across different protocols. So you've mentioned issues around technology transfer, around skills development and human resource capabilities, around substandard products and counterfeit products. So I think this touches upon different protocols of the AFCFTA, including intellectual property, technology transfer, rules of origin, and also increasingly, I think, e-commerce, in terms of getting access to these products. So I think regulatory harmonization and using AFCFTA to really leverage intracontinental trade, I think, is also quite key. And I think that, is quite evident from your intervention. So thanks for that. And so maybe I'll just, go on to Bridget now. So I think we've spoken, about the supply chain, the demand side shocks and the supply side shocks, and also more broadly in terms of the regulations that are needed to build domestic capabilities. So Bridget, I was wondering from you whether, you can talk a little bit about the sort of broader environment of the supply chain. So does supply chain really operate in isolation during a crisis? Or do you really need to collaborate with different stakeholders? And if so, which are these stakeholders, and to what extent do you really collaborate in that ecosystem?
Yeah, so we definitely, supply chain definitely cannot act in isolation at any time, but more specifically, definitely not during a pandemic. So throughout the supply chain, there's so many different actors within the supply chain that we need to collaborate with. And we need to collaborate both internally and externally as well. So if I can explain maybe on the internal side, so supply chain is very much connected with the commercial business, with finance, with quality, and with our regulatory teams as well. So the supply chain needs to work with regulatory to determine what is possible and what is not. As an example, if you need to bring in a different pack because it's a medicine that's urgently needed, but it's maybe not a registered product, or you're bringing in a different pack to what's registered, we need to work with our regulatory team so they can work externally with the regulator to determine what kind of permits or waivers we would need to be able to accommodate that, to ensure that we do provide product to the patient when it's needed. So on the other hand, also still internally with our finance team, when we're making those risk decisions of, do we go ahead and manufacture the demand that is looking like 4 times more than what we would normally need in market? If we don't see that demand pulling through, the risk of obsolescence, can we take that risk or not? We cannot make that decision in isolation. We need to work with our financial teams as well to take those decisions. Most importantly, though, in our external environment is really getting as close as possible to the customer and, if possible, to the patients as well, and really understanding their need of medicines of the, in every single market within whichever area you work in. So during the pandemic, we saw a lot of interaction, especially with our public sector stakeholders, where we were supplying on a regular basis our stock levels, explaining to them our capacity, really giving them a much more transparent view of what our supply chain looked like and what we were able to support and not support. So that was really key during the pandemic. We don't do it as much now, I think, because they have a better understanding and we have a better understanding now of what that demand looks like and what they are looking to us to support. So that for us was really key. And also with the, we had some quite severe export restrictions as well imposed during the pandemic. And again, we had to work with our external stakeholders there to determine and work out a, let's say, an improved process to apply for these licenses and permits to be able to ensure that product could flow out of the country to patients in other countries that we do support as well, because we needed to ensure sufficient supply within the countries we're in. So in my case, in South Africa, but also, we do support some of the export markets as well. So there was a lot of collaboration. I think within supply chain, we just spent from morning to night speaking to people and collaborating, which was great and much needed. So definitely not something we can do in isolation.
Yeah, thank you, Bridget. I think, yeah, we were seeing a lot of sort of medical protectionism at this, earlier in the year with, bans on exports of medical products and, certain medicines and pharmaceutical products, to other countries also in dire need of these products. So I think to really, bring into perspective the role of licenses and permits, at this point, and also engagement with stakeholders, both internal and external. So you spoke about public sector stakeholders and communicating with them, with customers and patients, quite transparently and clearly. And I think here also we saw that, technology was playing a very big role, with health tech coming into play and, patients finding it far easier now to access more information around COVID, around availability of medicines through these technologies and, digital applications. So I think, engagement with customers as well as then engagement internally in terms of business quality teams and regulatory teams. So really, as you mentioned, it was about a state, an ecosystem that the supply chain is working within. So I think that's a very interesting point to take note of. I think this would be a good point if we can bring in Alessane to share some of his points as well. So, we've discussed quite a lot about the sort of reliance of medical goods from international suppliers. So I think Joseph also mentioned that, a lot of these African firms are repackaging medicines, but they're not actually conducting the manufacturing within the domestic boundaries, or, manufacturing of APIs, for instance. So Alessane, maybe from you, we can hear a little bit about, so what was the impact of some of the supply restrictions that were imposed by some European states, particularly on African markets, in terms of medical supply of medical products for COVID? So what was the impact of these bans on the African pharmaceutical system? And in your opinion, what are the key recommendations that we can take going forward?
Thank you very much. I'm Alassane. I'm a pharmacist. I'm from Senegal. Senegal is a Francophone country. I do my pharmacist in France. Now I'm based in Clermont-Ferrand in France. Clermont-Ferrand is a little city in France. This is why you see my accents. Sorry for this. Okay. The first impact is not at the beginning the out of stock about health product. Unfortunately, the first impact is we had in African country, specifically in the Francophone country, we have a lot of falsified health products, unfortunately. At the beginning, country was ready to have the stock for 1 and 3 months. At the beginning, in the March, April, and June, we had a lot of, again, falsified health products in Africa, specifically in Cameroon, in Senegal, in Burkina. This was our first challenge. And the second impact, again, is not out of stock at the beginning. The second impact was we had a lot of donation. We had a lot of donation from Japan, from China, from outside Africa. Unfortunately, with this donation, we don't have any pharmaceutical reference. We don't have any reference according to WHO guideline about donation. We had out of stock maybe in June. In June, we have the out of stock specifically for essential health products like paracetamol, like ibuprofen. And at July, we saw in some country, we have out of stock about HIV and malaria products. This is that was the impact of the COVID-19, specifically in the French African country. Lot of donation without any pharmaceutical reference. Lot of falsified products. And in June and July, we have out of stock about paracetamol, ibuprofen, etc. And what we can do, if you see the pharmaceutical market in African country, specifically for Francophone country, we don't have any pharmaceutical, domestic pharmaceutical product. This is our first challenge. What we can do? My colleague Joseph says African unit plan. The problem of this plan is, okay, you can have the unit of the pharmaceutical finished product. If you don't have the APIs, the active pharmaceutical ingredient, if you don't have the packaging product, you can't have the product in our country. In some country like Cameroon, like Senegal, we had some only finished pharmaceutical unit production. Our problem is we don't have the API, the active pharmaceutical ingredient. We don't have the packaging product. This is a challenge. What we can do, this is the question. After the impact of COVID in pharmaceutical health sector, the first recommendation before we have the pharmaceutical unit production with API and packaging product, we need to do the joint procurement. Why I say this? Let me take one example. If, for example, if you take one country of Mauritania, of Guinea-Bissau, of Guinea-Conakry, the pharmaceutical market is very little. If you need to buy the product, for example, 100 products, you can't have the supplier because your market is very little. That's why during the pandemic or without pandemic, we need first to have the joint procurement between African countries. For example, we can do the procurement between Senegal, Burkina Faso, Mali, Mauritania. If you do the joint procurement, we can impact in the international pharmaceutical market because you have a lot of quantity. This is the first, my first recommendation. And second recommendation is we need to have the, how do you say, the regional pharmaceutical strategy. Now, if you see some country, we have, every country has a specific strategy against COVID-19. The problem is the country, the market again is very little. If you have the specific strategy, you can't find the product. You need to have the regional specific response to the COVID-19. And my last recommendation, this is a short recommendation, we need to have not only national, we need to have the regional, maybe African, a specific distribution health product during health cases. For example, if you see in Europe, if you have problem in France, you can use a system from Germany, from Belgium, etc. We need to have maybe the same in Africa, the regional specific distribution product during pandemic situation, during crisis health situation. We need to have this to join our resources. This is my short recommendation. Maybe let me back to the long-term recommendation. In face of COVID-19 and after COVID-19, we need to have first, like the situation in Maghreb, in Kenya, in Tanzania, you have some pharmaceutical unit product. My opinion is we are going to implement the pharmaceutical unit production for finished product, yes. However, we need to have at the same time, at the same country, at the same level, maybe it is a regional vision, we need to have the API unit pharmaceutical production and the packaging unit production. If you have the API, if you have the packaging product, you can do everything. And the last thing is the human resource. I see in some country, we are ready to have the building of the unit production. We are ready to have everything. Unfortunately, we don't have the strong human resource to do the production. That's why we need to have the link between our university, pharmaceutical university in Kenya, in Angola, in Senegal. We need to do this brainstorming, how we are going to have this strong human resource in our Africa. This is my answer to your question, quickly. Thank you.
Thank you. Thank you so much, Alisani. I think 2 points which emerge very clearly from your intervention. Firstly is around perhaps buffer stocks, that the impact was not felt immediately, but slightly in the more medium to longer term, which might bring into question the length of buffer stock or the importance of having that. And secondly, I think a point that emerged from your intervention is around the role of APIs and using, developing capabilities in the continent for API manufacturing, so to say, to climb up the value chain ladder and, to gain more economic rents from within this sector. And we spoke a little bit about potential ways of doing this, whether it is through joint procurement, at the regional or continental level, developing regional strategies for building skills, as well as for pharmaceutical specific strategies, and also very importantly the distribution systems. I think that is even more important now when we're looking towards the COVID vaccine development. So I think distribution obviously emerges as a very key point, at sort of the end, last mile of the supply chain. So thanks. I think that was very, very useful. And maybe I'll just quickly ask Joseph if he had any, points to make or intervention around the point of joint procurement, that Alisani made. So Joseph, anything to add to that?
the points raised are critical. And that is the reason why most regional economic communities, they started for a number of years with support from WHO to start dealing with issues of pulling together their efforts to procure or share information on specific products. In Southern Africa, in East Africa, and I believe in West Africa, the regional economic communities for a number of years have been tabling this issue, pulling together for procurement purposes. But we are aware of the disparities that exist between countries in terms of various laws pertaining to trade, industry, as well as finances. So what has happened so far is that for food procurement, what has been on discussion is to say, at what level do countries need to put together efforts to procure? And what do we mean by defining the food procurement? So in essence, it takes about the minimum of 3 countries who may need to come together in an organized way to address issues of food procurement. It's at different levels because you have to look at the models. We have informed buying, where countries would come together and simply share information on prices or suppliers, but they'll still procure on their own. Because the problem is that there's been no control on pricing when it comes to suppliers. They would sell a product in country X for 50 cents, and then country Y would be paying more than $2 for the same product. But there are also efforts that so far in Southern Africa and East Africa, they're dealing with issues of informed buying and coordinated informed buying, where they would undertake joint research market for sharing information on suppliers, because countries have got confidentiality clauses. And in most cases, information at the level of regulators or level of pharmacists, by law, they may not be allowed to share information on how much they are paying to a particular supplier because of the agreements they go in. So this matter is actually ongoing now to ensure that up to the level of centralized contracting or purchasing or centralized food procurement, which is level 4, needed to come together. But it's not as easy as that. We have to look at all the procurement laws to harmonize them, to ensure that the issues of rules of origin, the issues of various taxes on products, medicines, as well as you look at issues of medical devices, and how to deal with donated products, which sometimes may not be well labeled. All these, you need some kind of an informed law, which the African Union is also taking advantage, so that there's a common position on understanding or dealing with this. So yes, indeed, food procurement is a matter that has been on the table, and some regions have applied. But with all these currencies, some of the countries, they don't have currencies that are classified to be regular on the currency market. You may find it's always difficult to procure together when you find that maybe a rand is more appropriately put on the market than a Zambian kwacha. So you may find problems there on how they could buy or procure together.
That's very useful, and the point that clearly emerges from this is the importance of upgrading within the pharmaceutical manufacturing value chain for African countries, and the role that technology can play in this. So it's not just about developing manufacturing capabilities, but having that enabling environment in place for getting access to technology and skills for that to really be a reality. So thank you everyone for some excellent interventions. And in the interest of time, maybe we'll just do one round of concluding remarks, or any last takeaways that you would like to raise at this point, whether it's in terms of the most important sort of policy recommendation that is needed now, to build resilience of manufacturing supply chains, or to increase resilience of the pharmaceutical sector to any future economic shocks and crises. So maybe we can just start with Bridget. Bridget, any last thoughts or takeaways for us?
Yeah, sure. I think around resilience and supply chain is really collaboration, digitization, and working with our external stakeholders and trying to get as close to the patient as possible, to really understand the true need in market for our patients. So building an agile supply chain, as I said earlier, doesn't take, it's not a quick fix, it takes a long time. And it takes a lot of stakeholders to get to a point where you can have an agile supply chain. And in future, and like you said earlier, with the COVID vaccine distribution coming up, I think the supply chain is never going to have seen this before. And we're really going to have to be agile and find quick solutions to get the vaccine to all the people in the world eventually. So yeah, I think agility, digitization, and collaboration are really key to driving the supply chain forward.
Great, thank you, Bridget. Alessani, any last thoughts?
Yes, please give me 5 minutes. Just to Joseph, I'm totally agree with Joseph about joint procurement. It is very critical. However, it's possible. We have here in French African country, we have 2 examples with ACAM. ACAM is association of the national procurement agency for each country. I can share you with Joseph this example. For me, how do you say, the critical point for the future, if my prof says the future is now, not tomorrow, the first point is we can use digitalization for the distribution of the last mile assurance. For me, this is the potential of Africa to use digitalization. It's one of way to improve the supply chain management system. And the other thing is how we are going to improve the maturity of the supply chain model. This is very important for supply chain. And my last point is about financial resources and the technology transfer. The first point, the financial resources, how we are going to mobilize the domestic financial resources. It's very important for us, for the supply chain, for our hospital, how we are going to use our domestic financial resources to improve everything about the supply chain. This is very critical for me. And the last point is it's how we are going to do the link between the private and public sector. How we are going to implement the partnership, private and public sector, to improve everything about the health system, specifically the pharmaceutical sector. We need private sector to improve the public health sector. Thank you very much.
Thank you. Thanks, Alessani. Joseph, over to you.
Just to agree with everyone, but the most critical for Africa is to strengthen the regulatory oversight. We don't have independent regulatory authorities. Most of the authorities are attached departments in the ministries of health. Hence, when you have donations, they all pass without being blocked because it's politically linked. Secondly, is to say that whereas there's been that effort, the issue of quality in terms of safety and the efficacy of medicines is another one that needs to be capacitated, so that the products that reach the user are not only safe, but they are not adulterated so that they become dangerous products within our community. And lastly, but not the least, to say that the issue of vaccines is also another critical one that needs to be addressed, particularly when it comes to storage. when it comes to manufacturers and distributors, they have, as we have seen with COVID right now, we need a technological development that can accommodate the vaccines that are stored at a level of -80 degrees. We have a problem now with that, but also to say that indeed medicines are critical in public health, but they are also abused or misused because of lack of regulations and pricing, which is also not regulated. Thank you very much.
Karishma, can I add something, please? Just 1 minute. Joseph,
Okay.
as you know, Africa is ready to have the AMA, African Medical Agency. We hope one day this organization can help Africa about the pharmaceutical guideline and etc. I'm totally agree with you about the vaccine, specifically for how we are going to manage the condition in Africa.
Great. Thank you, Alisani. So thank you, everyone. Thank you to all the panelists for an excellent and very insightful discussion, on the supply side shocks. And maybe if I can just conclude and gather some of the, observations that have emerged in the panel. So it's clear that, the pandemic has posed both demand side shocks, but also supply side shocks. And it's not just the immediate shock or the impacts, but we're also seeing it, more in the medium run as well. And what has really emerged important is the role of sort of regional economic communities and the AFCFTA to really tackle some of these key issues around building domestic capabilities in the sector, including around technology, including around skills development, and the role that digitalization can have, not just in terms of building capabilities of manufacturing, but also in terms of delivery.
Yes.
So one was the role of digitalization, but also broader infrastructure, as Joseph mentioned in his last point. It is also around getting, for instance, the air conditioning right for the vaccine. So it's about getting that infrastructure more broadly, also it plays a very, very important role. And another key point that emerged was the importance of collaboration across different stakeholders that Bridget mentioned, both internally in the supply chains, but also externally. Public-private sector collaborations. And then what emerged important was the importance of improvising and improving regulatory oversight. I think that was also mentioned by Joseph, and safety of these products. So I think, some very crucial and critical points have emerged from this discussion, and which I'm sure some of them will also be dealt in the other panels. For instance, there's another panel happening on new opportunities in pharma supply chain, which I think also deals with aspects of technology. And others that touch upon mobilizing domestic finance, which Alessandra also mentioned as critical. So once again, thank you to all the panelists for an extremely valuable discussion. And I hope everybody enjoyed this. Thank you.